Hello, everybody, and welcome to the Bridging Frequencies Beyond FSM podcast, where I get to interview stellar practitioners across disciplines. Today, I'm very, very excited to share with you Dr. Shelley Rachal, OD, FOVDR. She's a neuro-optometrist and fellow of Optometric and Vision Development. She is a super wonderful human being and a super smart lady, and I'm so very excited to welcome you. Shelley, thanks for being here today.
Thank you so much, Jesse. I could say the exact same thing about you. I think you're such a great provider. You're so intelligent and just intuitive. I love how you really take the time to listen to your patients, myself being one of them. And I just love the work and the energy that you put out into the world. So thank you, and thanks for inviting me.
Yes. Oh, thanks so much. And thanks. I mean, I think we are drawn to each other just because there's these wonderful similarities. And also, there's a whole heck of a lot that you know that I want to understand. And I'm so excited to have this conversation with you. But let's first, because when, like growing up, I went to the eye doctor and, it was like, okay, we did like a vision assessment and I didn't really have any issues, or at least he didn't, find any issues. But what you do at Niwa Eye Care and Vision Therapy is a little bit above and beyond your standard eye care. And so I'm just hoping to kind of help everybody land and be like, wait, what is so special about what we're talking about today versus what you might get at a standard allopathic general optometrist. So let's start there.
Totally. So, one of my main goals of talking to you today is just to have people understand how complex the visual system is. Vision is much more than just 20/20 clear eyesight. There's actually 35 different areas of the brain that all have to deal with visual processing, and there's 305 intracortical pathways dealing with vision, and that's at least 305. So there could be even more. It's a very complex visual system, and without getting like too into the details, there's sight pathways and there's also non-sight pathways, meaning that it just needs light. It doesn't really matter if you see 20/20 or not.
Fascinating. So I'm going to
Yeah,
slow you down, Miss, because holy
totally.
cow, hold on. Wait a minute. In PT school, we did a little section on vision, right? And we're like the occipital lobe of the brain and the optic nerves, and it was so basic. And
Right,
you're telling
right.
me 30, wait, how many areas of the brain?
35 different areas of the brain, including like the cortex, midbrain, cerebellum, um,
Oh.
pineal gland, thalamus, hypothalamus, pituitary. I could go on and on.
This is amazing. And I feel like this is, I don't know, it's updated because I have an out-of-date understanding of the visual system in the brain. But as someone who works with frequencies and I'm starting to learn more about light, it's like, of course, pineal gland, of course, some of these other centers, but like how? And anyway, we don't have to necessarily get deep into that, but that's just a very striking like, I don't know, it's not even a statistic, it's a fact that all of these, and then the pathways, the visual pathways you're describing, more than 300 of them, that alone is like, okay, wow, this is in depth. So when someone comes to your office, what is different about how you interface with that person versus how somebody might interface in a standard optometry office where they didn't go on and get their fellowship and do all of this additional specialized training?
Totally. So, at our practice, we are more so a holistic vision care practice. So, it's not, like I said, it's not just like vision is 20/20. You get your glasses or contacts, check eye health, you're out the door.
Yeah.
Um, at our
That's what
practice.
most people, sorry to interrupt you, that's what
Oh, it's
most people would
okay.
expect at a standard optometrist, where you go in, you check your
Mhm.
20/20, you get prescribed glasses, maybe they do something for your dry eye or something, or maybe not.
Totally check eye health, and they're kind of like the primary care eye doctor.
Mhm.
Um,
And
but
you guys are kind of like functional eye doctors. In if we're making a comparison between like allopathic medicine and functional medicine, where allopathic's like, what's the problem? We've got 15 minutes. What's your problem? What's the drug I can give you, or whatever I
totally,
can give you to send you home with, versus what's the problem? What's the root cause? Where did that come from? And and going a little bit deeper, and then giving you more of a holistic like way to treat.
totally. So we deal with the visual system as a whole, and vision integrates with your other sensory systems like your vestibular, your proprioceptive, your balance. Um, it integrates with auditory and speech. I think I got most of them. Kinesthetic as well. So essentially, we take a look at a lot of different visual skills. There's 17 visual skills that, as a whole, our type of practice would look at.
Hmm.
But essentially, just to like kind of group them together for simplicity's sake, in general, we take a look at your visual input skills, which is basically how your eye is tracking or fixating from one target to the next. How are they able to track a moving target, which is called a pursuit? We look at the accommodative system, which is your eye focusing system. So we all have a tiny lens inside of our eye. It's kind of like a camera lens. It's supposed to focus to get things clear up close, and then relax focus to get things clear far away, and how flexibly it can do looking near to far. So we take a look at that system too. Binocular system, of course, which is huge. Um, how your eyes work together as a team, if they aim together in space, if they're aiming properly in space on the target you're trying to look at, which impacts depth perception. But also, we look at a lot of visual processing skills. One of the areas in visual processing that I find like the most fascinating is actually not to do with that central 20/20 eyesight, which is like the last step of trying to look at something.
Mm.
The first step is actually the very first step is that you need to have that internal motivation of past experiences of like, what do I want to look at? What am I trying to accomplish with my vision? Um, but basically, the next step after that is you have to use what's called your magnocellular processing system, which basically it's like your peripheral vision, but it's much more than just like peripheral vision. So that system is able to process like where things are in space,
Mm.
where you feel like you are in space, um, how objects are in space relative to you. So basically, just like those different spatial cues. Um, and also being able to process motion in your periphery. And basically, this would be really relevant to you with you working with a lot of concussion patients too. But basically, your central 20/20 eyesight kind of visual processing and this magnocellular processing system are supposed to be in balance and working together at the same time. And a lot of people, because there's so many of those pathways throughout the brain when there's a concussion or an insult to the nervous system, which vision is the nervous system, um, that can really wreak havoc and cause a lot of these like feelings of I don't know where I am in space. I feel that disoriented, dizzy, lightheaded feeling. Oh, I can't go in grocery stores. There's a lot of motion in my periphery. There's a lot going on. Um, it can cause light sensitivity. people to go into kind of tunnel vision and lose their peripheral awareness, which is important for all the skills I just talked about. So that would be like my biggest area that I love to like investigate and work with patients in vision therapy is helping them regain that processing of that magnocellular system and being able to integrate it with that more central 2020 system.
Cool. So the magnocellular system, am I saying that right?
Yes.
Is like how we sort of, it sounds like it's emotional and from past history and from like there's multiple levels of nervous system input that you're working with to
Totally.
help like sort of sync back it up in a way that makes being make helps the body know where it is in space. That's something I work with a lot with my hypermobile people too. It's like the
Totally.
proprioception is so challenged. And then also, yeah, integrating with it sounds like safety. And
Hmm.
that's like a I don't know, it's like a hot topic right now in anybody who works with the nervous system. It's like how can we help this system feel safe with whatever is happening. And if there's some visual input problem, but what you're saying is like it's the whole brain that we're
Totally.
talking about when we're talking about vision, then that needs to also be addressed in order for us to feel safety or whatever, feel okay in our experience as moving through the world visually.
Totally. Yeah, it's definitely about feeling safe in the world because if your vision is not working the way it's supposed to, and I guess I should back up and say so there's two different types of issues that can occur. There's what's called bottom up processing, which is like how is the process from light coming in your eye onto the back of the eye, the retina, being transferred to the back of the brain? Is there any kind of eye turn or things that could impact that input into the system? But there's also this top down processing, which is okay, now it's all the information in the back of the brain at the occipital cortex or visual cortex. And how is that information being sent throughout the brain to be integrated with the body and our other senses so that we can navigate our world safely and comfortably? And that is typically what is very impacted in concussion patients. It's almost like instead of your brain operating on a software system that's like really quick and efficient and it's like very fast processing, it's almost like on a old school hard drive that's like very very slow at computing. You see like the spinning wheel of death. And that's typically like how people feel. So it's not like most of the time there are cases where of course there is like something physically or structurally wrong with the eyes themselves, but most of the time it's that like software problem where it's that processing and the connections and integrating vision with the body, to be able to do what you need to do in everyday life.
I appreciate, yeah, like how helpful what you guys do over there is for concussion. And also just even the evaluation process that you guys go through, it just seems so complete. And the naming of the various like parts, muscles of the eyes, and so on helps me as a frequency specific microcurrent practitioner go, oh, we've got a frequency for that. And one thing that kept that just I'm just sharing this with the audience if you happen to be an FSM practitioner. As I'm working with people who have concussion, post-concussion syndromes, there's an experimental frequency for the occipital lobe of the brain. And when we reboot, because there's a frequency to reboot, and remove the fact of trauma from, and remove scarring and adhesions from that part of the brain, it is such a, it's like, it's a huge leap for many people, not everybody, of course, but thanks to like relationship with Niwot Vision and getting to treat more and more people with concussion, which is like my passion too. It's an interesting, it's really helpful because some things I would just never have thought of are coming through on your initial evaluation report, and I'm like, oh my gosh, we have a frequency for that. What can we do to support that system? So anyway, I'm just kind of relating this a little bit to FSM, but I think the bottom line is it's so important as practitioners to have like therapeutic like partnerships with other therapists that are doing things that we can't. You know, I don't know how to do that type of an assessment. I don't have the technology that you guys have over there. And it's so helpful for me to know that information in my care plan too. So can you, well, I want to give you a chance if you want to reply at all to that, or we can move on to concussion because I'd love to dive in a little too about concussion.
Yeah, I think the only thing I was going to add is I completely agree. It definitely takes a team, and not even just for my concussion patients, but even children with learning problems because of their vision, or people that are just really emotionally stressed out because vision also ties into emotions and can be impacted from stress, like being able to refer to the appropriate providers. I always want my patients to have that like full, complete care and not just what I can do, but what can other providers do so that they can just actually feel better and feel empowered to be themselves, which is the ultimate goal in life.
Totally. I love that you're saying like vision has to do with emotions. I think that that's a very interesting perspective that I don't know that many people like know about. Can you speak a little, just a little bit more about that? I know you mentioned a little bit earlier, but can you speak more about the intersection between the visual system or I forgot the word already, the bigger system and emotions?
Yeah, of course. So like I said, there's some visual pathways that aren't dependent on clear eyesight and just like light coming in, it can tap into the hypothalamus and the pituitary, and then other just like emotional processing systems and hormone systems. Um, but one example I have is if someone's having, like, let's say, an anxiety attack where their heart's racing, they're in that sympathetic fight or flight mode, their vision can get blurry because their pupils dilate. They're not able to like focus appropriately in space. They may be more light sensitive because of that. And then it's like a vicious cycle because you're having these crazy visual symptoms out of nowhere, and then you're even more anxious, if that makes sense. So it's almost
Yes.
like this vicious cycle. So definitely, and like I said before too, with concussion patients, if they don't feel safe, they don't know where they are in space, where other things are in space around them. It's very confusing. That can also cause like a lot of anxiety and stress, and then it makes their peripheral vision shut down even more, and then they really don't know where they are again. And yeah, it's definitely vision and emotions go hand in hand for sure.
I really appreciate you saying this because, you know, as a practitioner, sometimes we're doing all of the things that we know to do to support the nervous system, activate the vagus nerve, whatever we're doing, right? And if clients are still not dropping out of that, like just to use your same example of like anxiety, panic attack sort of cycle, it's like what else haven't we looked at? And for me, it's like, oh, the visual system for sure. That's something that it's like if what I'm doing is not getting somebody out of that response, I'm like, maybe go and see um Niwot Vision and see what they come up with. And often that is an important factor, the visual system. So
Helpful too. I can share with you our symptom checklist that we have for both just like general visual concerns, but also ones that are more tailored to people with a history of concussion.
Amazing.
Or even people who have cervical instability that present like concussion patients.
Yes, totally.
Mhm.
Awesome. That would be wonderful. And if there's a chance, I'll put some of those symptoms checklists even under this video so that people watching can be like, oh, okay, this is what I'm looking for referring out when
Totally.
appropriate. Yeah, perfect. Wonderful. Well, what is your favorite, not favorite, but just why do you love treating concussion so much? Because I do too, and I want to talk about concussion.
Totally. I think for me, very similar to you, that's why I love you. But for me, I think it's that a lot of these patients have seen all of the providers. We're usually the last stop. People don't think of vision, even though it's all throughout the brain. Um, but a lot of people have these like very odd symptoms that no one can seem to like figure out or pinpoint and just throw medication at them or other things that aren't super helpful. Of course, there's medications that are, but they're kind of like plateaued out in their symptoms, and they feel like they've lost all hope at that point where they're like, I just don't know what's going on, and will I ever feel like myself again? Um, and just being able to tell them, like, yes, you do have visual diagnoses that are seriously impacting your everyday life. And even if we can't get them back to 100%, we definitely can get our patients back to being able to function and enjoy life again without feeling like, oh, I can't go to the grocery store. I'm going to throw up because it's like way too overwhelming.
Yeah. Yeah. Awesome. Um, what else? So beyond concussion, what do you love treating or what do you love about the work that you do?
Totally. I love all of it. But I would say I have a soft place in my heart for children who struggle in school because of their vision. Children who have ADHD or are on the spectrum or giftedness, twice exceptional. A lot of those kids also have these deficits in either their visual input skills, like eye tracking, eye focusing, eye teaming, and also that visual processing aspect as well, which is important for reading, writing, spelling, math. Um, so helping those kids as well is really important to me. And then also definitely Syntonics, which is light therapy. I think that is very similar to what you do, just a different kind of energy healing coming from
So cool.
sound.
Sorry, say that again. I think I interrupted you.
Oh, no worries. I just said Syntonics is very similar to what you do. It's just energy healing, but with lights instead of sound.
Amazing. So I had never heard of Syntonics, and it's um I thought I had spelled it out somewhere. Syntonics. Is that right?
Got it.
Okay. Syntonics. So and it's light therapy, but how does it work? Can you like kind of paint a picture of like what does this look like? How do you test if somebody needs it, I guess, and then what does the therapy look like and yeah, make it help it to become concrete for me because I'm like, wait, what? This is so
Totally.
cool.
So, to be honest, probably most people that do have any kind of visual skill issue, their peripheral vision is most likely collapsed or they're not really aware of their periphery. Um, the periphery is huge. Like you need your periphery, like I said earlier, to process motion, spatial awareness. But even for things like knowing where to look at a target in space, like looking at my finger in my periphery, am I able to see that and make a quick, accurate eye jump to that target? So even things like reading, if you're like super focused on every single letter versus kind of being zoned out and able to see the page as a whole, you'll be able to read faster versus if you're like looking at each little letter. Um, so all of that to say is Syntonics, basically one of the biggest goals from Syntonics is to help expand that peripheral vision or peripheral awareness. And not to say it's like some structural issue like glaucoma where it's like some disease that's making your periphery like black or not just available to you, but more so an intentional factor of like being aware of things around you versus like not being aware.
Hmm.
Mm-hmm.
And so that has to do with color and light.
Yeah, totally. So, um, one of the non-sight pathways, I feel like I've said this multiple times, so I'm sorry.
Okay, no, it's good because it's like because it's new to all of us. I mean,
Totally,
you just got your fellowship, so it's probably very not new to you, but this is like such an interesting, like new way of looking at things. So totally.
totally. But that same non-sight pathway I was describing earlier, where it goes to the hypothalamus and the pituitary and the pineal gland. Basically, it can tap into the nervous system through this pathway and regulate your hormones and chemical imbalances or things like that that impact the nervous system based on what color or frequency of light that you're using. Um, in general, more red colors are going to stimulate the sympathetic, the fight or flight, and then more blue colors are more so stimulating that rest, relaxation, more of like a healing state for our concussion patients. And then green is in the middle, which is where you want to end up eventually, which is nice and balanced. Not overly parasympathetic and not overly sympathetic, but a nice genuine balance.
This is fascinating because like the majority of the earth is green, right? And trees and
Totally,
like there's that kind of I don't know, that's just what I thought of when like if that's the balance point, so much of what's around us, maybe a little less in Colorado because we're a little drier climate here, but green is such a healing color and
totally,
it's yeah. And it's really interesting too. There's so many people are really into like red light therapy right now and like making sure they're not getting blue light toxicity from their screens um
right.
and it's an interesting concept that I like turn on my red lights in my office at night if I'm here and I'm wearing my blue blocking glasses. And sometimes I'll get feel like irritated. And I wonder if it's like a sympathetic activation from this perspective of syntonics. Like and yeah, I wonder what you would say about that and about the kind of whole, and I don't know if you're following this part of light, but people are sort of demonizing blue light and worshiping red light. And I wonder if it's a little more subtle than that, perhaps.
Totally. I feel like personally, I feel like all colors are important. We need that blue light because that's what regulates our circadian rhythm. And without that, we would be an insomniac mess. um, but also for the red lights, it definitely can be beneficial. As you're saying, like the low infrared lights or low level infrared lights is helpful for inflammation. And they actually are starting to use that now for macular degeneration. Um, but that's why Syntonics is so important to be done with a provider who specializes in it, just because there are certain tests that we do. We look at your pupils to see if you would benefit. Essentially, what we're looking at is when we shine a light in your eye, which normally light constricts the pupil or makes it smaller. And it should stay relatively constricted as light is shined on it. It may like slightly come up, but that's it. But a lot of people, especially concussion patients whose nervous system is stuck in that fight or flight sympathetic nervous system, and the parasympathetic isn't quite doing its job, you shine the light on their eye, it constricts, and then it pretty rapidly starts to get bigger and bigger because it can't sustain that parasympathetic control of constricting the pupil. So that's
Fascinating.
one test we use that is pretty cool. We also do like functional color vision field tests. So unlike a typical visual field test, if anyone's ever done one, it's the one where you look in the instrument and you have to look at a center target. And anytime you see a little flash or flicker or movement, you click a button and it maps out what can you see in your periphery. This is more so looking at how are you able to process different colors and motion. It's not just about like can you see it, it's more of a like functional visual field, like processing the motion as well as how well you're able to perceive those different colors along the visual spectrum, which can indicate different things. But essentially, a lot of times when we do those tests, they're very, very collapsed. Even though on a traditional visual field test, it's normal, on these, it shows how much their functional peripheral awareness is very collapsed and impacting their ability to use their visual skills in everyday life.
Great. Yeah, thank you for that. That's helpful. And it also kind of like loops back to the question of like, how is this different from a standard vision, appointment, right? You're going much more in a nuanced way, which for people that, well, like probably for everybody this benefits, but especially for those people who have tried a lot of things and are not getting the results they want to. So so when you do this assessment that maps how collapsed or expansive the peripheral field is that the moment when you as a practitioner is like, okay, we're going to use red for this one person or blue because of this? Like and maybe this is hard to answer without an actual example, but where is the decision point with like how to take somebody in a certain direction with the lenses you're prescribing or the color you're prescribing? Because I'm imagining that it would go in glasses as a prescription. Um, or how do people use the color like in their daily life too?
Yeah, good question. So how Syntonics work is in the office, we have something called a syntonizer. It almost looks like a giant telescope, kind of, and you look in there and get to look at just the light coming in. You actually don't even have to look at it. You can keep your eyes closed because it'll still penetrate through the eyelids and tap into the nervous system. So for like super symptomatic patients, it's helpful. Um, what was your first question? Sorry.
I know, I'm so bad. I ask like 10 questions in
No,
one.
it's okay.
So you were talking about there's like a connection that I'm just not making between the peripheral vision and like the color somehow.
Oh yeah. um, so how we determine the color is dependent on multiple factors. So it's for me, sometimes it's almost like intuitive based on like how they're presenting with their nervous system. And a lot of times though, I would say like concussion patients, obviously, they're more stuck in fight or flight. So we want more of a calming blue side of the spectrum to relax their nervous system. Um, and then typically more of the reds are for people who are just either so emotionally exhausted over time that they almost like they're almost in like that collapse state where it's like you need to give them some energy, that red sympathetic to help um, boost their nervous system and rebalance it. Um, but also for kids who really are just not visually aware and they're not aware of their body or where they are in space, for those kids, we'll use more of the red spectrum too because they need to be more aware of their environment. Um, so it really just depends. It's a super hard question to answer with without being like, here, like, take this course. But
Yeah.
in general, that's like a very, very like
Yeah.
general way of answering it. But it really honestly, I also just like just because these colors typically work well for someone, I always test it because you never know. Everyone's unique and their nervous system may actually not respond well to it. So you
Mhm.
definitely want to make sure that it's the right color because, like you said, for you, red is like not your thing. So you definitely don't want to be under that kind of like constant stimulation of red light if it's something that your nervous system is like, this is too much.
Yeah, I think this is an important point in the current culture of at least like I get a lot of people who are like self-proclaimed biohackers and all of this, and it's like like there are amazing benefits and there's also nuance. So it's
Totally,
and you spoke to it. It's like even if you have a sense or it's like, oh, according to this, you should have blue, but you're always going to test it first to make sure that that nervous system is good with it. So that's fascinating.
totally. And just like you, also really listening to the patients and really getting a good understanding of what it is that they're struggling with and different ways that we can help them, whether that's with Syntonics. Another huge two topics, which we're probably going to talk for like 5 hours then, is like just treatment with like lenses and prisms, especially yoked prisms, and also vision therapy, of course.
Did you say yoked, like Y-O-K-E, yoked prisms? Oh, interesting. So I just want to like interject really quickly because the reason I even know about functional optometry, functional ophthalmology is because Carol McMakin had an FCOVD guy present at her advanced conference a few years back. And it was so fascinating. And he talked a lot about prisms and some of these very simple visual tests that we can do as practitioners to know when to refer out to somebody like you guys. And the prisms thing, there were just a couple of like just amazing transformational cases he shared where it's like this is how this person walks without prisms and then they're just bloop, they're totally like their motor control of their entire body changed just by having that prism input and it was so interesting.
Totally. I
Yeah.
feel like the general idea of yoked prisms is, or just in general, people who present with a lot of these visual symptoms are most of the time, I would say, it's just that their perception of visual space doesn't match like true visual space. So the point of the yoked prisms, it basically taps into the like posturing centers of the brain to help reorganize someone's posture, which again, it's another one of those non-sight related pathways, but it's super important because it helps to reorganize how someone perceives space and match it more with like true space. So it's like matching their true center with how they perceive their body center to be, if that makes sense.
Totally makes sense. And it's like it's it's almost like you can't even believe what a difference it makes until you see it. It's pretty remarkable, at least in like some of the examples I've seen where, okay, I'm just gonna take these off and like show you how I walk across the room and then put these back on
Totally,
and be so much more organized. And that's like that's such an interesting perspective from a body worker or a, manual therapist or a massage therapist, somebody working on somebody's posture and like really like whatever they're doing to try to like optimize that from that perspective. It's like probably those people don't always think of, well, what if it's coming from like how the brain organizes and understands where it is in space? And this would be another example of when to refer out to somebody like you guys. So, um, so
totally.
cool.
I agree. I love what I do.
Yay, thank you for doing what you do. And um,
Thank you for doing what you do. A
I
lot of my people to you.
thank you, thank you. Yeah, I wonder if we probably should wrap up here in a little bit. Is there anything else that we haven't talked about that you were like, oh, I hope I get to talk about this today on the podcast, or like, or even just like if you could tell the world any one thing about um, functional vision, optometry, what would that be?
Yeah. Um, I'm going to end with what I started with. Vision is more than 2020. Um, if you're having a lot of symptoms that can't be explained from other providers, like difficulty in crowded environments with movement in your periphery, double vision, eye strain fatigue, difficulty with reading, or sustaining any kind of near work, difficulty looking at computer screens. I could go on and on. I will send you the checklist though. But vision is more than 2020. So if you can't figure out what is happening and it's causing you a lot of stress and anxiety in your life, please come see either me or Dr. Amy Chang, and we would love to take care of you. Thank
Yay, amazing. Thank you so much.
you so
It's
much.
so great to learn from you and also just be able to share patients who benefit so much from an alternative perspective that many people might not have even considered before. It's really interesting. I do end up doing a lot of education around this concept that you've named multiple times, like your eyes are connected to your brain. Like even the optic nerves are potentially like an extension of a part of your brain, right? And so it's so intimately linked and we providers we can't know everything and do everything individually. So hooking up with people who are not just kind of showing up to the job and doing their 2020 vision screen, but like going so far above and beyond to really serve their patients' brains and nervous systems and processing and safety and all of that. And I think that you guys do such a phenomenal job over there. So thanks for doing what you do.
Jesse, and thank you for being the wonderful provider you are.
Thank you.
Yeah.
We'll close out for today and see you guys next time. Thanks, Shelley.
Thanks again.